Hello, everyone, and welcome to HealthWise. I'm your host, Kelly Crane, with the Waco-McLennan County Public Health District. And today, our guest is Asmita Ghimire, and you are a graduate assistant with our health education and our Live Well Coalition, Live Well Waco Coalition. And part of being a graduate assistant is that they make you go on TV with me. But we're going to be talking about something extremely important. We talk about this every year, and that is heart health, and it is Heart Month. So tell us, we talk about it a lot. Why do we need to keep on talking about heart health? Why is this important?
Yeah, so like you said, February is Heart Health Awareness Month, and it is so important to talk about heart health and heart disease because heart disease is the leading cause of death for both men and women in the United States. Every 40 seconds, someone in the United States have experienced heart attack. So if you and I sit here for about 15 minutes discussing about heart health, 23 people will have experienced heart attack.
So you think about that, this is a 30-minute show, so that adds up to 46 people.
Yes,
46 people
that's correct.
In our life, 46 people. So that's significant. As you're watching this, we don't want to be heavy or down, but this is really important. It affects everyone. It touches everyone. So let's just jump in and really start with the main thing. What are the risk factors of heart disease and a heart attack?
Yes, that's a really good question. There are so many risk factors. Some of them are like your health conditions, your lifestyle, your age, and your family history. These factors increases your risk for heart disease. So these are called risk factors. About half of all Americans have at least one of three key risk factors. And these three key risk factors include high blood pressure, high cholesterol, and smoking. There are some risk factors like your age and family history that we cannot control. But however, there are so many risk factors like improving your lifestyle. It will help you lower the risk of getting heart disease or heart attack.
I think that's important. Whatever your risk factors are, even if your risk factors are a part of your family history, it doesn't have to be a part of your family's future.
Right.
That you can make small adjustments that will make a tremendous change to your heart health. I think that's important to emphasize. Now, of course, here we are. We've gone a year with living with COVID-19, and of course, COVID affects every part of our life. Let's talk specifically about heart disease and how COVID can affect people with heart disease.
Right. Unfortunately, COVID has very strong impact with the people who are living with underlying conditions such as heart disease or cardiovascular disease. Patients with underlying conditions such as cardiovascular disease are 6 times more likely to be hospitalized and 12 times more likely to die than patients without any chronic conditions. And also, about 1 in 3 people with COVID-19 have cardiovascular disease, making it the most common underlying health conditions.
And if you think about, like you said, heart disease in the beginning, heart disease touches everyone. It's the #1 for men and women.
Right.
So of course, here we are, we have this we have this heart disease, even if it's slight. And COVID-19 can make a great effect on this. So This is not just about extending your life, but protecting yourself from all other illnesses, particularly COVID-19. So we've kind of got the doom and the gloom here. It's serious. We need to take it seriously. There's lots of risk factors. But now let's talk about what we can do to lower risk, because it's not all doom and gloom. You're not destined for heart disease. And even if you are dealing with it now, there are things you can do to make yourself better. You can improve that underlying condition. So let's talk about how we lower our risk.
Yes, that's correct. It is a leading cause of death. Does not mean it has to be. It does not means it cannot be prevented. There are so many ways we can adapt. There are so many ways we can do to prevent heart disease and heart attack. So people with cardiovascular disease who adopt healthy behaviors can strengthen their body against COVID-19 while also reducing the long-term risks from cardiovascular disease itself. So a healthy diet and healthy lifestyle are the best weapons you can have to fight against heart disease. Remember, you don't have to change your lifestyle or everything at once. Start with 1 or 2 small things and go it from there.
And that's important. This also involves, goal setting. We are here at the first of the year, and of course at New Year, everyone makes resolutions and they join a gym and they're going to do things and they're going to only eat certain foods, and they make goals that are just a little out of reach or maybe not realistic in the beginning. start with something simple. Start with something easy.
Right.
Instead of taking things out of your lifestyle, add things to your lifestyle.
Exactly.
Yeah,
Yes,
don't punish yourself.
Exactly, I agree. Anything is better than nothing. So just
Exactly.
start small, and if you achieve that, then you can go it from there.
Exactly. So let's talk about, going down that list. And the first one is blood pressure.
Right.
And everyone, so many people just deal with blood pressure. The older you get, the more reality that is. Talk a little bit about that.
Yes, so blood pressures, like you said, so many people are directly or indirectly affected by blood pressure. So knowing your blood pressure is one of the way you can lower the risk of getting heart disease. Having uncontrolled blood pressure can result in heart disease. High blood pressure often has no symptoms, so it is very hard to recognize. So it is important to get your blood pressure checked regularly, just to make sure your blood pressure is within the normal range.
And so many people deal with blood pressure in our family that deal with blood pressure issues. And in the beginning, they didn't feel any effect of taking the medication.
Right.
But again, it was like, no, this is important. It's something that doesn't have symptoms, but it's going to affect you in the long run. You're actually doing something good for yourself as you take your blood pressure medicine.
Right.
And that also means you're going to have a closer relationship with your doctor, because you're going to see your doctor, you're getting it checked. So blood pressure is actually, that's an easy one to start doing.
Exactly.
If you need to take medication, take your medication.
Exactly.
That's a very easy one to start.
It does not look like you are doing, like taking blood pressure is helping you right now. But, if you look 5 years or 10 years from now, that's going to help you in the long run. That will help you to get, keep your body in a good line.
You're a
Yes.
Ferrari. You need to check
Exactly.
yourself like that. All right. And so the next one, of course, we hear this as another health issue is diabetes. And these two can go hand in hand. And diabetes can have a really difficult issue with heart disease.
Yeah. So diabetes is one of the risk factor for heart disease and many other diseases as well. So talk to your doctor or healthcare provider about getting tested for diabetes. So if you have a family history of diabetes, then you are more likely to have one. So having diabetes raises your risk for heart disease. So it is so important to get tested for diabetes.
Absolutely. And again, this is something that you can have control over you. It doesn't have to control you.
Right.
Having a physician, having that good relationship where you can talk about those, adding things to your lifestyle, make a difference with diabetes. Both of these go hand in hand.
Right.
They don't have to control you. You can be the person who controls it. Now, this is an interesting one, and we always talk about this, and it's a big issue, and that's smoking.
Right.
Talk about that.
Yeah, so smoking also increases your risk for heart disease and many other diseases as well. So if you don't smoke, then don't start. If you do smoke, talk to your doctors about different steps you can take to drop your smoking habits. I know it is challenging, just like if you are used to it or if you are in the habit of smoking, it might be challenging to quit it, but it can be done.
And that may be your only goal
Right.
for the year. If that's your one thing to change, that would be it, to quit smoking. And that includes vaping too.
Exactly, yeah. E-cigarettes, vaping, anything like with nicotine in it is not good for health.
If that's your one thing you can do that and focus on that. All right.
And there are so many resources locally and also online that can help you quit smoking. So.
All right. So there are options, and people will support you in your efforts to quit
Exactly.
smoking. So
Right.
don't give up on that. And then another one, of course, we hear this all the time. Cholesterol and triglycerides, and they're always, the older you get, they're just challenging for everyone.
Right.
Talk about that one.
Yeah, so like we discussed earlier, having high cholesterol and high triglyceride levels also increases your risk for heart disease. So it is as simple as going to a doctor and getting checked for high cholesterol and high triglyceride level. And also, just like, if you have a high cholesterol or high triglyceride, it can be prevented or minimized just by changing your lifestyle, being healthy, eating healthy diets. So which we are going to talk about a bit later in this conversation.
Exactly. So yeah, again, that's one where you can interact with your doctor, and that's important if you do have underlying conditions, if you had heart disease, if you have diabetes, having a relationship with your physician. So you understand what's going on with your body and how you control it, and the doctor understands it as well. So you already have that language. You can talk and really work on making sure your health is the best it can be. This next tip to lower your risk. I call this the mother rule because this is what our mothers teach us all the time, and that's eating healthy and exercising.
Right. Yeah, like I heard it all the time. You might have heard it all the time. People are public health professionals, even doctors, healthcare providers, focusing on, eating healthy, being healthy, and moving your body. This is because being overweight or obese raise your risk for heart disease.
Absolutely. And eating healthy, exercising, whatever your weight is, even if you're not considered overweight or obese, is going to make a huge change.
Right.
You can look at someone and assume, oh, well, they're in great health. They may not be. That cholesterol may be very, very high. That blood pressure may be very high. Eating healthy, exercising, it just goes so long. All of these go to a long way to keeping you healthy overall, whatever your situation is.
And eating healthy and getting your body moved, like it goes a long way. And we'll talk a bit about this later in our conversation as well.
Sure. And then, of course, alcohol. Now, this is an interesting one because you're not saying cut it out. You're just saying limit.
Right. So we know alcohol, a lot of alcohol or drinking a lot is not good for health, so if you drink, that's fine. You don't have to cut it off. Just limit your alcohol intake to 1 drink a day. So that will help you lower the risk for heart disease.
That makes a huge difference. Just not cutting it out, not doing overboard, just limit.
Right.
All right. Now, this one is always interesting. Lower your stress.
Yes.
And of course, we're in a time of pandemic. There is so much stress. There's so much added pressure to protect your family. If you have kids, making sure that they are getting their Zoom classes done, their online classes, protecting all of your family. Lowering stress is a tough thing to do right now. And it's probably more essential that we work on our stress.
Right. Yeah, I agree. It is like, lowering your stress is difficult, even like also in this difficult time or in these isolated times, it is even more challenging. So, but there are healthy ways you can use or apply to cope with your stress. So some of the ways are like taking care of your body or yourself by eating healthy, by getting plenty of sleep, and sharing your problems or how you are feeling with someone you trusted. These are the ways that can help you lower your stress level.
And so many people say, and this is something that people talk about, that when they're under that great stress, when they need that just release, that going out and walking or just doing something or moving or whatever it is, cleaning their bathroom, cleaning the kitchen, just walking, just something active gives your brain a chance to think about something else. Let your brain work through what stress you're going through.
Yes.
So
yeah, it's gonna be different for everyone. Just find your stress reliever and then just work on it.
And we need to find those. That's probably one of the most important things we can do at any time, but now more than ever. So now we talked about, of course, about exercising and moving your body, and let's talk a little bit more about that because again, this goes to goal setting where it's like, okay, it's a new year, it's a new me. I'm going to go to the gym at 4:30 in the morning every day, and I'm going to work out for 90 minutes. If you've never done that before, if you're not a morning person, that may not be the best idea.
Right.
Let's talk about that, particularly for people who really, they work in an office, and so it's not because they're lazy. They're just, their job requires that they stay still or they sit at a desk, even if they stand at a desk. How do you start incorporating exercise into your life, and what does it really mean to get more exercise?
Yeah, so, like you said, someone is going to set a goal for I'm going to exercise an hour a day, starting this year, but it can be challenging to exercise for 1 hour, especially if you have a busy schedule, or if you work in an office where there is limited mobility. But there are so many ways you can incorporate exercise or moving activities into your daily life. So CDC recommends an adult need a minimum of 30 minutes of moderate intensity physical activity on most days a week. So exercise, it can be broken down into small chunks throughout the day in the week. So it doesn't have to be 30 minutes, like from 5 to 5:30 or 6 to 6:30. You can break it down into smaller pieces, into like 10 minutes, and 10 minutes, or like 5 minutes, something like that. So it is also important to note that children should get at least 60 minutes of physical activity throughout the week, each day week. So,
and that's, again, that goes to the mother rule of, as a you know, if you're a mother, even if you don't have children and you were growing up, you know what your mother said: go outside and play. Go outside and play. You've been watching TV too long. You've been inside too long. Go outside and play. So we know kids have that energy. Channel that into them going outside and playing and have a good time.
Yeah, and exercise does not have to necessarily look like going to gym, lifting weight, or running in the treadmill. It can be as simple as walking around your neighborhood, taking stairs at your work, or walking your dog, dancing in your living room in your favorite song. Anything that gets your body moving will count.
Absolutely. And, we're here and we've got a remaining 10 minutes on this. So let's talk about the active versus sedentary lifestyle, because you have a little key or a code that I think is a really good way for people to remember it. And remember, we're talking about just add a little. Don't deny yourself things, just add a little. So let's talk about active versus sedentary and talk about your basic formula, which is a perfect formula.
Okay, so like you said, one of the biggest drops in heart disease or heart disease risk occurs when you go from living a sedentary life to a healthy or active life. So I have a little formula that will help you how to be active or how to go from a sedentary lifestyle to active living. So I would say eat 5, move 10, and sleep 8.
Eat 5, move 10, sleep 8. So let's start. Eat 5.
Okay, so this basically means eat 5 servings of fruits and vegetables a day to boost your health.
So and that's easy. That's not remove all of this from your life and substitute with vegetables. Add some fruit.
Right.
If you like blueberries, eat blueberries. If you like bananas, there's so many people that will say, oh, well, you can't have this fruit or you can't have that vegetable. Start with vegetables. Yes. Eat a vegetable. Add them to your life. And a serving is not that big. You think about, oh, no, I have to eat a whole bowl of fruit. No. Just a serving. A serving is very small.
Yes, I agree. Yeah, it doesn't mean you have to completely change your breakfast. You can just add a fruit to your breakfast. You can eat snacks on fruits and vegetables. You can eat fruits and vegetables in between your meals. As long as you are eating fruits and getting 5 servings of fruits and vegetables, that's all it needs. Also, do not worry about the food that you should not be eating. Just focus on getting those 5 servings of fruits and vegetables.
Okay, and then move 10. Again, we talked about this a little bit earlier, but this is exercise.
Yes.
Move for 10 minutes.
Yeah, ideally, sure, the government recommends getting at least 30 minutes of exercise a day. However, that might not be always the case. Add at least 10 minutes of physical activity into your daily lives. Ideally, yes, 30 minutes is great, but the bottom line is 10 minutes will also do a lot.
And be realistic about what you're doing. In our situation, we have 2 different buildings. You have to walk in between the buildings to get to certain meetings or to bring things over. So maybe it's as simple as I'll take the long way around the parking lot, and that'll give me a little bit of time. And so on my way, I'll take the long way, and on my back, I'll take the long way. And that gives me 10 minutes. And it's a way of working it into my action, making it normal into my routine. And that's a thing you can do with your breaks. If you have stairs in your building, walk up and down those stairs. It's little things that you can start to add. To take those goals in small bites, and you can make it happen.
Yes.
And now finally, my favorite one, I have to say, probably everyone's, is sleep 8. You've got to get your sleep.
Yeah, well, before we move into sleep, I just want to add
yes.
something. So yeah, there were studies that found that just 60 to 90 minutes a week of physical activity can reduce your heart disease risk by up to 50%.
And that is so important. That's a week. That's 7 days. That's not 60 minutes every day.
It's 10 minutes a day.
10 minutes
a day.
And
it reduces the risk of getting heart disease by 50%.
You know what? Those are winning odds. That's something. Think about that when you're thinking about exercise. I can't go to the gym and spend an hour and a half. Good news, you don't have to.
Exactly.
You don't have to. 10 minutes a day doesn't have to be something crazy overreaching.
No.
Just 10 minutes a day.
Just walking around the neighborhood or parking far away from your office. So yeah, from your building. So yeah, anything that gets your body moving will count.
Absolutely. All right. So, and now we're moving to the sleep. You have eaten well. You've added your 5. You've done 10 minutes for the day. Now you're exhausted. You got to get some sleep.
Yes, sure. Yeah, and sleep is the most important thing that can keep your body and mind healthy. Quality sleep is good not only for your heart but also for your whole body. It can be challenging to make time for good sleep and quality sleep, but it is very important. For 2 weeks, try to get at least 8 hours of sleep each night. And yes, each person's sleep need is different and it varies slightly, but 8 is a good number to shoot for.
It's a good number to shoot for, and you know your body, and you know what you need, and really work toward getting quality sleep. Work toward, when you are sleepy, go to sleep.
Exactly.
Go to bed. That's all you need to do. It really will make a difference in the long run. We have so many people that do the weekend warriors where they don't get any sleep during the week because they're up and they're up late and they're up early and they try and make it up on the weekend. Just gradual changes will make a difference all the way. And it'll give you more energy when you need to do that 10 minutes.
For sure.
And you'll have more energy when you're like, oh yeah, I need to have that fruit. It will really make a huge difference. So now here we are in our remaining 5 minutes. And we've talked about a lot of great things. We have our Eat 5, Move 10, Sleep 8. But let's talk again about the reality. We talked about how, people would be having heart attacks. How many people? 46 people within a 30-minute period could have a heart attack. So in this time, let's talk about what do you do how do you need to be aware of the signs of a heart attack? And what should you do when you see that happening?
Yes, like you mentioned, it is very common, like one of the leading cause of death for both men and women. And so it is very, very important to recognize those signs and symptoms of the heart disease and act immediately if you notice or see those signs and symptoms by calling 911. And some of the common signs and symptoms are heavy pressure on your chest, back pain or pain in your upper neck or in your neck, back and jaw as well. Severe shortness of breath, cold sweats, unexplained fatigue or nausea, and also unfamiliar dizziness or lightheadedness. These are some of the common signs and symptoms of heart disease. So if you see someone having these symptoms, please call 911 right away. A person's chances of surviving will increase if emergency treatment are given to the victim right away.
Absolutely. And so many people are hesitant to go to the hospital because they know COVID is a big issue and they don't want to take away resources. They know that hospitals are working hard and they're hard at work and they don't want to add something to it. But that's what hospitals are for. When you talk to physicians and doctors, nurses in hospitals, they're like, no, we do not want you to blow this off. We're here to help you. You are not getting anybody's way if you are seeking attention. It's important that you get treatment right away. And of course, again, there's also, I think, a little bit of, oh, well, it's nothing. Oh, well, I'll just walk it off. Oh, I'm just being lazy.
Yeah, heart disease. Yeah, exactly. Heart disease is not something that you dismiss. You gotta get that treatment.
Don't put that blame as in I'm lazy, or I'll just sleep it off, or I've just been working too hard. Take it seriously. Take it seriously every day. All right. Well, we have about 2 minutes left. So in our remaining 2 minutes, is there anything that you want to emphasize for us? Anything you want to say in our last moments?
Yeah, actually, I have an announcement or I want to add something. So February 5th is, or the first Friday of February is National Wear Red Day. So on February 5th, I would like to invite you all to wear red and support us and to raise an awareness on heart disease and heart health. Together we can eradicate this heart disease.
Absolutely. Go red. I've got my red on today. I've got my red mask. It's the perfect time to celebrate hearts and Valentine's and protect your Valentine, protect your heart. So, all right. Well, Asmita, thank you so much. We really appreciate it. And thank you for your service to the Health District and your service to our community. And of course, everyone, thank you for watching this month's Health Wise, or Heart Wise, we can call it, for February. We appreciate everyone tuning in, and we'll see you next month with another edition of Health Wise.